Good morning, all. So far, we completed natural methods, barrier methods, IUDs, and about pills. Today, we'll complete the rest of the topic of contraceptive, one of the contraceptive device or a method, that is surgical method. And you can see surgical methods are of two types. One is called vasectomy, the other one is tubectomy. Now, I'll just jump into that slide and we'll complete the surgical method. Now, look at here. The name surgical method or sterilization. Surgical method means, look at here, there are two pictures, and on your left side, you can see there is a one certain surgery in which the fallopian tube has been cut and ligated or tied up. You can see clip sealing the fallopian tube. So you know the surgery name. Obviously, it should be called as tubectomy because the fallopian tube is been cut and tied up. And here the on your right side you can see the vast difference has been taken out and it has been cut and then tied, and obviously the name of it is vasectomy. So this is surgical or sterilization. You can see the name of the word sterilization means that permanently disabling the sperm movement or the ovum movement into their respective tubes. Suppose if it is in vasectomy, sperm cannot reach to the or sperm or a seam, sperm itself will no longer travel in the vasectomy. Vas difference. But whereas in tubectomy, the ovum may not be moving from, not only ovum, but the sperm also, if it is introduced or inseminated, then it will not reach to the ovum of the tube or fallopian tube. Okay, so sterilization, you know that sterile and fertile. Sterile is opposite of fertile. So in this method, couples or the mother and father who no longer wanted to have children, they can undergo this procedure. So here you can see the terminal method is to prevent no more pregnancies. The same thing what we discussed here, vasectomy and tubectomy, the meaning cutting, removed or tied up through the small incision on the scrotum. And in tubectomy, fallopian tube is removed or tied up through a small incision. Incision means a cut made at the abdominal region, and then they use the scissors and they cut the fallopian tube. Okay. Now, so far, whatever we've learned, so far, all the contraceptive devices or methods we've learned, we should give a thought. Like what? You can say here some of the points should always be undertaken in the consultation with the qualified medical professionals. Remember all those things from right from the beginning. All the different types of contraceptive methods should be under the complete surveillance of the doctor or qualified medical professional. Apart from that, it's not good to be done. If in the absence of doctor is done, then that is not a good thing to do. Contraceptives are not regular requirements for the maintenance of reproductive health. Remember, in order to maintain reproductive health, you need not to use any contraceptive devices. That is the most important thing you should remember. So you can say that using the contraceptive device only give a proper reproductive health is a wrong thought. Third one, however, their possible ill effects. Sometimes remember there are chances that using the contraceptive devices even produce side effects, you can say, like what? Nausea, abdominal pains, breakthrough bleeding, even irregular menstrual bleedings, or even breast cancer are the some of the side effects if we constantly use the contraceptive devices. And please remember, it should not be totally ignored. That is the point. These are the three thoughts which you are supposed to be knowing before using the contraceptive devices. Okay, now let's move into the next one. Here you can see there are two pictures of showing two people fighting for one specific cause. And here you can see on your left side there are people who support pro-life. On your right side there are people supporting pro-choice. Why they are, what they are doing, and what is the cause for having a kind of a fight among themselves. Remember, this side of the people like who support pro-life are supporting not to do abortion, and on this side these people are supporting to be like allowing or fighting for uh, legalizing the abortion. Okay, now what exactly abortion? We'll jump into the next clip. See, MTP is a term dedicated to the a medical procedure in which termination of pregnancy can be done surgically, or you can see induced abortion, IAMTP. Both are synonyms. Intentional or voluntary termination of pregnancy before full term is called medical termination or induced abortion. So, any mother who wanted to end the or abort the child, that procedure when she goes to the doctor, that doctor do is called MTP. There are some factors which you are supposed to be learning. That you can see according to our textbook, around 45 to 50 million MTPs are performed in a year all over the world, which accounts around one fifth of the total number of conceived pregnancies in a year. You can see the drastic number right over here, and this is the number which have been collected in the year 2006. And just remember what is the number right now, that is in the present time. Now you can see right over here there is a debate going on all over the world, like whether to accept the abortion, whether to not to legalize the abortion. It's such a big debate right now going on in terms of like emotional, ethical, religious and social issues involved in it. Okay, whether to not to legalize or legalize the MTP is a big debate right now going on, even right now in 2020 also. So many countries have legalized the abortion, and not so many countries uh, are legalizing the abortion. That means they are going against to the abortion. There are some infographic pictures right over here. You can see 1 in 3 women in have abortion in her lifetime. 9 in 10 abortions occur in the first 12 weeks of pregnancy. And you can see what are the cases where abortion can be done is one of the cases is rape. This is the picture of the whole world where a rape has been done. You can see the highest dark orange color, especially these countries. So you can say that the rape is directly proportional to the number of MTPs done in that country. You can see India shows that a rape that can be done per 100,000 people. So we are very less. But you can see the countries like these, the rape is being done in tremendous number. Here you can see there is a picture of, or a GIF you can say, contraceptive used around the world from 1994 to present world. You can see there are some the coloration is given. You can see the things which we have discussed so far: the pills, the tubectomy, using of male condom, intrauterine devices, vasectomy, using implants, withdrawal, calendar methods, and other traditional methods. You can see the change in the color. You just compare with the you can see, suppose if you see the Russia in 1994, majority of them are using IUDs, but right now present, you can see they are opting for male condoms. You can see even in USA also. Once they used to be using IUDs, right now they are going for use of male condoms. And even if you see our country is no more using. I think they are using only male condoms only. But there you can see there are coloration. Suppose if you see Egypt, you can see in 1994 they are using IUDs, but right now they are drastically changing to use calendar method or other traditional methods. Okay. Now, if you come to our country, what are the statistics related to MTP? In our country, India has regularized MTP in 1971 with some strict conditions to avoid misuse. Right over here, you can see um, the female victims. If you see the statistics of Indian female victims of rape, the age group at which it has been increased in many fold is between 18 to 30 years, and the victims have been so far between 15,000 to 20,000. Total cases reported rape are around 34,651 individuals have been undergone the rape. So you can see that is like a disturbing number as well. If you see the abortion incidence in India, in 2015, 15.6 million abortions occurred in India. 78 of them, these are outside the health facilities. Observe that percentage, 78%. So that is huge number, and that is not done uh, approved by or done by the doctor, but it is done outside the vigilance of the doctor. Half of the 48.1 million pregnancies in 2015 were unintended, and then third ended in abortions only. 81% of abortions were medications abortions, and 14% were surgical. So here the graph showing the facility based abortions and incidence abortions. So this is also an alarming number uh, that is taking place in our country. Why MTP is required? Why abortion should be done? The reason why is unwanted pregnancies either due to casual unprotected intercourse, that means like without using contraceptive devices, or maybe sometime due to the failure in the device, that is a contraceptive device, during casual wanted coitus or unwanted coitus like rapes. Essential in certain cases where continuation of pregnancy could be harmful, remember harmful, or fatal either to the mother or fetus or both. So this is the other condition where MTP can be performed. MTPs are considered relatively safe during first trimester. Remember, MTPs are suggested to be done by the doctor is during the first trimester, that is first 3 months of the pregnancy up to 12 weeks. Now, the second trimester is the place where one should be thinking whether to do the abortion or not, because it is very riskier compared to the first trimester. And think about the third trimester, it's such a big thing to be done. Now, being said that MTPs are good, but there are some things that is misused. Majority of the MTPs are performed illegally by unqualified people, which are not only unsafe but could be fatal too. Remember, this is the most important thing. Anything that is done outside the vigilance of the doctor is fatal and unsafe. And right now, you remember amniocentesis. This is such a bad thing right now in our country is amniocentesis, misuse of amniocentesis, like determining the sex of the unborn child, like before the child is born, uh, mother and father illegally ask doctors to tell the sex of the child. If they come to know that the fetus that is being grown in the mother's womb is a female, then obviously they opt for medical termination of that fetus. Such a bad thing, and this is totally against to the legal or the government. Okay, so that means we can say that MTPs should be done under the medical vigilance and under the professional people. And remember, MTPs are illegal. Only the case, that the case where MTPs should be performed is during this only or this. Apart from that, rest of them is illegal. Okay. Thank you and have a nice day to you all.